Today we are joined by Nishith Trivedi. Nishith has previously worked for the likes of Accenture, BAE Systems, SZ, and is currently the Director of Global Master Data Management at Pfizer in the US. He'll be joining our 7th annual Master Data Excellence in Life Science Conference and presenting alongside his colleague AJ Varganin. Nishith, thank you for joining me.
Thanks, Jonathan, for having me. I'm looking forward to this conference.
Thank you. What we'd like to start with is just to get a few insights on how do you see master data management creating value at Pfizer?
Yeah, I mean, that's definitely a broad topic. So I'm the MDM lead here at Pfizer. There's also SAP MDM kind of a separate thing, but anything non-SAP is under my purview. We master many domains. So we have, obviously customer, which is our, very critical domain, HCPs, HCOs, doctors, nurses, professionals, and organizations, and all flavors of organizations, right? Like, from, hospitals and clinics to suppliers, vendors, etc., and health systems and the affiliations between them. We also have, patients and consumers being mastered. We have, products being mastered. So it's a very kind of active domain. In terms of value, like there's, the traditional kind of, customer MDM supporting your commercial organization, which is sales and marketing, to, the omni-channel view of like what's happening with customers. But then, now we're kind of going to Pfizer-wide customer centricity initiatives. And so MDM really is playing a key role there, right? We want to be able to capture, in theory, right? Like obviously with compliance, we had to kind of make sure we're kind of doing the right thing. But, where possible, from a compliance and consent perspective, right? Like capture a 360 view of every interaction any customer has with Pfizer across any channel, whether it's a commercial channel, like a sales channel, marketing channel, through medical affairs, through call centers, through clinical trials, through contracts, through research grants, transparency events, speaker programs, etc. So and kind of the real value of all of that is moving Pfizer away from like a sales rep led, marketing led organization to being more like customer led, right? Where a customer determines what is the way they want to interact with Pfizer, what kind of content they want to receive from Pfizer, what channels do they want to interact Pfizer with, right? So our goal is really to be more customer centric, and this is obviously across all pharma industry. Everybody's saying it, but we're basically putting our money where our mouth isn't, really investing in that right now. I would say on top of that, we have other flavors of MDM. So things on the contracting side. We have lot of kind of MDM capabilities to kind of stitch all our accounts and accounts data together across different systems, contracting systems, sales systems, external distributor data, and that helps us kind of see where who's buying, what the trends are, how do we kind of better react to that, how do we better support our customers, So that's going to be a key piece going forward. And then lastly, I think and I'm going to touch on that a little bit later as well, but from an analytics perspective, right? Like traditionally MDM end users were more like functional areas like transparency reporting, right? For like reporting back to governments in terms of how much spend we have for HCPs and sales and marketing organizations, right? For digital like CRM, Salesforce enablement and digital marketing. Now more and more like MDM end users are really the analytics team. They're kind of the ones who are saying, we don't want to spend like a lot of half our time, in the analytics world to kind of do data preparation. So they're coming to us to say, hey, how can you better stitch this data together, govern the data, do stewardship on the data so that we have better ROI on our analytics in terms of being able to do it faster and cheaper, as well as to be able to get to insights faster for our end user.
And that's really interesting to hear, especially about that idea of customer centricity changing things. I mean, in your presentation at the conference, you're obviously going to be talking about the cloud. I mean, what are the key benefits that you see cloud MDM providing, and sort of what are the main challenges in the transformation?
Great question. So yeah, we have basically like now made the Reltio cloud platform as our central enterprise MDM platform, and so we're basically trying to move everything to Reltio. I think like we've done a pretty good job. We already have 100+ countries on the Reltio platform, so on our cloud already. And then there's a few pockets of countries where they have some local solutions, and we're kind of working on the roadmap to kind of transform everything to the cloud. In terms of the key benefits, really, I think like compared to traditional, on-premise type solutions, right? Like with benefit of the cloud, of course, number one is really just easier to upgrade. They have, like weekly, quarterly updates, which just keep happening in the background. So we don't have to spend a lot of time kind of upgrading, right? Like moving from one version to another. We basically, in an agile way, we can just start using some of the new features when they come out. Um, Again, on-premise, they had capability to kind of do API and real-time streaming stuff for that, but it was really more kind of batch focused, right? The architecture was more batch heavy, whereas the cloud stuff is like API native, right? Like it's API first. Everything is really kind of API driven, and so that kind of helps us, like as we integrate with more other modern solutions, other cloud-based solutions, like we're doing a lot more real-time kind of connectivity between systems, right? Think about it like from a customer journey orchestration perspective, right? You want to be able to like see where the customer is in their journey at all times and be able to give them next best actions, or give them recommendations in terms of new content to look at when they log into portals, etc. So similar to how like an Amazon would be giving kind of new recommendations, right? We want to be able to do that in our kind of websites and portals and companions where people log in. And really, so the goal is have all of our different systems interconnected, real time or near real time, so that they have access to the latest and greatest customer data. So by doing that on the cloud, it's cloud native. We basically have kind of a middleware on top of that to help support API and streaming as well. And we're trying to move all of our downstream systems to kind of get there.
Very interesting. And I think something you mentioned earlier as well is also with data-driven organizations. I mean, how do you see master data aligning with other disciplines, sort of analytics, data science, and I guess that would be a relationship you see developing further in the coming years, or how do you see that evolving?
Absolutely. So as we kind of do our MDM governance, right, like our traditional kind of governance in user stakeholders were really like sales, marketing, transparency, medical affairs, and now we're bringing the analytics teams, right, so on board as well, because they are kind of a source of like a lot of new innovation for us, right? They're, as part of the customer centricity, they're doing a lot of things like trying to figure out like what kind of customer insights you can get in terms of either HCP or account potential. What are the preferences? What are the attitudes? Right? Like what is the adoption preference for like HCPs for like different products? How are they looking at treatment choices, right, for patients? How are they looking at kind of the treatment journey, right? Like what are their decision drivers? What are the influence, right? Like as basically the ecosystem is kind of evolving, right? There's a lot of consolidation in the industry. There's a lot of independent practices or group practices being bought over and now part of health systems. And so a lot of the influence which previously HCP was making influence on the decision of what drug to prescribe, now maybe coming in more from an organization perspective. The other thing is from a traditional kind of Pfizer or pharma industry perspective, life science industry, really, the rep access is basically now, changed, right? Obviously with the COVID now, it's, a lot more remote and a lot more kind of virtual, but even before COVID, right, we had a lot of, a lot of access, being lost because, people were opting out of like, or, they were basically not available to meet with reps. Mm-hmm. And lastly, like, like preferences in terms of what kind of content do you want, what kind of channel do you want, email, do you want face-to-face, do you want to get digital, text, etc. So because like, our analytics team is very heavily involved in figuring out what does the customer need, right? How do you become customer centric, and what are the things which they care about? Like we're basically trying to support them, and so by basically bringing in new data sources to integrate into MDM, or basically find ways to kind of support them, as part of this journey.
Mm-hmm. It's really, really very interesting. And we're really looking forward to hearing your full presentation on the 2nd of September. I'm sure you'll be sharing a lot more insights there. So thanks again for your time, and we'll hear off you again in a couple of weeks, alongside some of your peers from the likes of Jonson Johnson, Sanofi and Bayer. So thanks again for your time, and speak soon.
Thanks, Jonathan. I'm excited to be there, and looking forward to kind of hearing from my peers as well.
Brilliant. Thank you.
Take care. Bye.